Morning, everyone. My name is Jacqueline Ventura. I'm the Community Health Worker Liaison for the COVID vaccine and pregnancy outreach to pregnant women. I wanted to welcome everyone for being here and just to point out that there will be a post and pre-survey that you need to complete. And let's start with introductions. I wanted to start with Dr. Rivera. If you could please introduce yourself.
Yes, good morning. My name is Sorimar Rivera Nunez, and I'm an assistant professor of epidemiology at Rutgers School of Public Health.
Thank you for being here. Danica, if you could please introduce yourself.
Hi, yes, good morning, everyone. My name is Danica LaFortune. I'm a community health worker supervisor, co-program director, and community doula for SPAN Sister to Sister Community Doulas of Essex County.
Thank you. Kashika, if you could please introduce yourself.
Hi, my name is Kashika Phillips. I am a community health worker with New Destiny Family Success Center.
Thank you for being here to speak about this important topic, which is vaccines and pregnancy. Dr. Rivera, I'm going to start with you. Can you share the latest recommendations surrounding COVID-19 for women who are pregnant or trying to become pregnant from the current research that we have?
Yeah, so the latest CDC's recommendation is for all women that are pregnant or want to become pregnant or were recently pregnant to get their COVID vaccine. It does not matter if you're breastfeeding or not, but that's the recommendation. If you are not vaccinated, your risk of getting more serious COVID is a little bit higher than for the rest of the population because women that are pregnant, their immune systems are a little bit low to foster that pregnancy. So that's the latest recommendation. Like women that are pregnant, recently pregnant, or want to become pregnant, they should have their 2 shots and the booster shot as well.
Okay, and what does research say about the vaccine during pregnancy work? How does that work to protect the health of the baby, other than the mother?
Yes, so there's some research done in that area as well. So latest, a few investigations have shown that babies up to 5-6 months of age, they have they show that they have the antibodies to fight the virus during that age. And that's what we're seeing now, right? So we need more research to keep following the children. But then that is giving you like an additional boost for that baby during those first 6 months of life to be better protected against the virus. And we have not seen any adverse outcome just because mom got vaccinated during pregnancy. I just want to make that clear.
Okay, and this next question is to the other participants, to Danica and Kashika. Over the past 2 years, we know that the COVID pandemic impacted almost every facet of our health and lives. What has been the biggest impact that COVID has had on those who are pregnant within the families that you work with? Kashika, I don't know if you want to start.
Yeah, I think one of the biggest issues definitely was financial reasons. They weren't able to pay their rent, and if they were pregnant, they were scared to go for prenatal care. That was the biggest one. And definitely because they had to, visit their doctors by themselves. So they weren't able to bring their partner or their family members. So that feeling of isolation was definitely a huge, huge part of it.
Yeah, I agree with that. We definitely saw the isolation. Especially because a lot of women had to do again, like she just said, their visits on their own, deliver on their own. I actually was pregnant during the pandemic. I had COVID while I was pregnant during the pandemic. But I know for me, I ended up having to have a C-section. And once my husband left, that was it. He couldn't come back. But he had to leave because we have other children. So he had to tend to our other children. So definitely isolation, even socially, lack of social support because everything is virtual. We are so used to being in person and having physical support from people, and that was just lacking, even from down to doctor's appointments sometimes, how a lot of moms had to have or use telehealth. So I would definitely agree with the isolation, definitely the finances, and the social part.
Dr. Rivera, I don't know if you want to add anything of any kind.
No, that's exactly what some research studies have shown. The isolation, the feel like you don't have any support or help. It's the stories of the women, but it's also what it's shown on research. And it's not we are not over with that yet, right? So when the family has COVID, they isolate the children. You know, they have feelings that they cannot express. Moms cannot express, you know, they're the support for their family, so they have to keep going. And pregnancy, you know, by itself, is a period of a lot of changes. So all these external changes that comes with the pandemic are just are hard to handle and very difficult for any woman that is pregnant and have COVID, or any woman that is pregnant and have children with COVID or somebody around them.
I agree with what all of you said. I think one thing that all connected was the fear that many mothers had, and that led to the isolation that I also heard from a lot of my clients. The next question that I have is for Dr. Rivera. The approval of the vaccine for those over 6 months and up is pending for approval. I apologize. And that can come any day now. Can you please provide us with any updates on that vaccine that's for children over 6 months?
So actually, the past on Thursday, June 15, today is in Wednesday, the FDA, they met to decide on this and how to move forward. So I think it's coming anytime soon now, because technically, so for the other ones, every time they met, for the Pfizer, Moderna, for any vaccine that they approved, they met, and a couple weeks after, they come up with final recommendation. That's exactly what they did the first time that they tried to approve the 6 months and older vaccine when it was done, when it didn't pass. So in the next few weeks, we should hear about that for sure.
That's great. Thank you. Dr. Rivera, can you also please explain how the COVID-19 disease is spread? I think there's a lot of confusion going around in the internet on how people get their information. We would like to know how the COVID-19 is spread. So the
COVID-19 today, right? We know that it's like it expressed for it's close contact, right? If a person that's COVID-19 positive, they have their virus around them, right? In their nose, their mouth, their hands. So you're close contact with them, it's the higher with the chances that you're gonna get it. It also spread by droplets. So if I sneeze, right, I'm all my fluids have COVID. So if I sneeze, it's just gonna go some distance. That's why recommendation of staying 6 feet away. So in that way, those droplets, when you sneeze, they go down to the floor or to the ground, and then they don't reach the next person. So those are the main ways for COVID-19 to spread. You know, from early on in the pandemic, we were not sure because it was a new virus and we didn't know much about it. And there's tons of different things that you can find on the internet or people can say. But those are the main. That's exactly how COVID spread. Close contact with a person that has COVID, and droplets, or a person that has COVID had some droplets, sneeze or cough around, and somebody else come and breathe or talk, and then they touch themselves with those contaminated droplets. That's basically.
Okay, we were just talking about how there's a lot of information in the internet. I think another thing that many people get confused with is the fluctuations of COVID-19. What are the factors that contribute to the fluctuations in the number of COVID positive cases?
So there is multiple things that contribute to fluctuation, not only for COVID, but for other pathogens and viral disease. You see that they fluctuate. And that's what we call a seasonal fluctuation. That means that during the year, we're going to see more cases some months and less cases other months. Pathogens, they don't look at the calendar, right? They don't know, they don't care which season we are in. One of the strongest factors influencing COVID, it's human behavior, right? And what do we do and what we don't do. And crowded environments is it's one of the most important parts for COVID. When winter approaches, we tend to be inside for longer periods of time, all of us there. So that's a place, that's an environment that COVID likes, and it's easier to spread. While in summer, we spend more time outside. So that's one of the reasons for that variation. And we see it in other viruses and other diseases too. We can see that in flu as well. There's another potential factor is humidity. So if you have higher humidity, those droplets just stay there for a long time. So there's more potential for a spread. Excuse me. Then there's some factors intrinsic to the virus. For example, how effective a virus is, and we have seen that every time we have a new variant, we have some changes on those peaks for cases, right? So if the virus is very effective, like Omicron during December, you're gonna see higher chances for getting sick, so much higher cases. That's exactly what we have seen to some of the variants. Variants in December, you have two things colliding. You have a variant that it spreads very easily, it's very contagious, and you have a time of the year where most people just stay inside and together because it was in the middle of the winter. So those two factors there, so you can see the fluctuation. As soon as we left that, Omicron just went down, and the cases go down. Another things are the social fluctuation. You know, we are social people, so socially you fluctuates during the year. So when you see more social activities like Christmas or any holiday or, you know, Thanksgiving, you're gonna see peaks right after that because we are together. So there are factors that directly related to the virus and how it is spread, not because we, you know, because the virus just spread only in one time of the year or the other time of the year. It can be summer, and if you all get together to celebrate any holiday during summer, chances are after that gathering, there's more people are going to have COVID than if they were not gathered together during the summer. So there's multiple factors, and they're all played together. And you're going to see more cases or less cases depending on how many more factors you have, how many factors you have at the same time during, you know, X amount of time.
Thank you for that explanation. You briefly mentioned new variants. We know that there are new variants that are identified. What does that mean for the vaccines that we have and their effectiveness?
Right now, the research suggests that the vaccines that we have, they're effective to the new variants, right? And I just want to reiterate that the effectiveness is for severe COVID and mortality and death, right? So that's the main purpose of the vaccine. It's not that you get COVID or not. We are fully vaccinated in this house, and my son just got COVID last week because he was at school. He had like a really minor, very mild symptoms. The rest of the family, we didn't get sick, although we were wearing masks. We did all the protocol just to see if my other son could finish school. But that's the point of the vaccines against severe disease and death. So what we have now is working. You should boost, because the boosters comes with that additional support for your immune system. So the recommendation right now is the 2 shots and the 3rd booster for everyone that can do that.
I agree. I also got the vaccine, and when I got COVID, I got very, very mild symptoms. The next question that we have is for Danica and Kashika. Despite the vaccines, including the COVID vaccine, being recommended during pregnancy and to those who wish to become pregnant, there are still some people who are hesitant to getting the vaccine. How do you go about speaking about getting the vaccine with your clients? Danica, if you could please start.
Sure. So the first thing that we always do is we give the information, right? We share the evidence, we share the information, the scientific data, because those are the facts, right? So we're always familiarizing ourselves with the CDC guidelines and the new recommendations and the updates so that we can give our families, you know, the latest information. So that's the first thing. We always make sure that we can at least give the facts, right? And then the next thing we do is we have to validate their fears or their reasons why they don't want to get the vaccination. You know, we serve Black and brown women, so we have to validate that there are some fears and concerns because Black and brown people, Indigenous people don't trust healthcare systems. They don't trust doctors, and there's history behind why they don't trust doctors in healthcare systems. So we validate their fears and their concerns and their feelings because those are true feelings for them. And we can't just gloss over and say, you know, history happened so long ago, you shouldn't still feel this way. We don't do that. So we validate their fears and their concerns. The next thing we do is that we just keep giving the information and hope that some way along the line, especially for a pregnant mom, a pregnant person, that she might change her mind. We share our own personal stories. We share stories of other people, you know, positive stories about the vaccines. I personally share my own story. Like I said, I was pregnant and got COVID March 2020. So way back when in the beginning when they were still trying to figure things out. But as soon as I was able to, I definitely got my vaccine, and as well as my family. So we definitely try to share the information because we believe in informed consent, that we give all the information and you make the decision that's right for you and your family. Some people, it just might not be ideal because of their household circumstances, whatever the case may be. Some people, it's a religious thing. So we definitely don't want to respect or disrespect their religious beliefs or concerns. So again, we give the information, allow them to make their own decision, and then also, okay, so maybe you're not for the vaccine right now. What can you do? So you can wear your mask when you're going out. You can test when you're not feeling sick. Go get tested. I know for me, I suffer with allergies, so I have been getting tested, you know, multiple times just to make sure, as well as my children, just to make sure that, okay, this is just allergies. This isn't something else. So we, you know, recommend wearing your mask, washing your hands, your 6 feet of this social distancing, getting tested. So even if there might not be for the vaccine right now, what can you do? What are some steps that you can still do to make sure that you're safe, your baby's safe, the rest of your family is safe? So always want to respect the people that we work with. But again, sharing the information, sharing new relevant information has been impactful because we have seen some pregnant moms who were reluctant in the beginning, but eventually came along. Sometimes, unfortunately, it was because of a story of one of their family members that had gotten really sick or whatever the case may be. So that changed their mind. But we have seen people who were reluctant in the beginning come around to wanting the vaccine. So we keep at it, not in a pushy way, but in an informative way.
Yeah, excuse me. Yes, to follow up with that, I think, you know, Danica had a wonderful explanation, and we pretty much do the same exact thing. I want to emphasize, I definitely share my personal stories because I was pregnant also during the pandemic, but the vaccination didn't come out until after I had the baby. So I always share my story and why it's important to me. But I also ask them, you know, what is your fears? Like, what are you worried about? Are you worried about the side effects? Are you worried about, you know, how it might affect your baby? And try to just settle those nerves as much as possible by sharing any type of latest information. You know, I compare maybe some type of, you know, element that they have, maybe they're like diabetic or something like that, and try to find information related to share with them so that they can become more comfortable with the idea of getting the vaccination.
That brings me to my next question. You work directly with the community. How does the COVID vaccine education information get to your families?
Well, for me, I use a platform called Simple Texting, and I have all of the participants that I work with their phone numbers. So anytime I have any type of latest information, I use that database. And it could be anything from when the COVID-19 home tests were being sent out, and you could like fill out the form. I sent that to them so that they could have the home test whenever they were ready to use it for them and their family. And then also, luckily, at New Destiny Family Success Center, we do have a COVID team. So they're also sharing information. You know, we're doing outreach together, and they're always accessible if I want to connect my participants with them.
Yeah, I agree. With our agency, we also have, SPAN also has a COVID-19 team that we work closely with. So as they're getting information, new information, they give it to us and we're sharing it out as well. We text as well. We don't use a platform like Simple Text, but we will individually text moms information as needed. Like I said, the flyers that our agency has, they'll send them to us. We'll share them out. We're always sharing out the flyers digitally with our partners, our community partners, because they also serve pregnant women. So we just want to make sure that all the bases are covered. But we have been really fortunate in our organization, because we do have a COVID-19 team, to be able to get a plethora of information out, whether it be digitally or actual flyers and handouts. So we're always able to share information.
I thank you. I would like to add to that. I think as a community health worker, I also advise my clients to talk to healthcare providers. I think that's the best that you can do to have the best informed decision that you can make. Our next questions. How can you help your families keep up to date with the changes with evidence-based information? Because information is changing all the time and there's a ton of it in the internet. How do you go about that? Danica?
Well, for us, we like I said before, we like to stay with the science, and so we always recommend the CDC website. Also, on our organization website, we get information directly from them as well. So if some families are already on our website for something else, we'll recommend them take a look at the information that's on our website about the latest updates, because we do update them as they come out. But we definitely make sure that they are sure about their sources, because there is so much information out there, scary information, optimistic information that might not even be true. So we definitely recommend that they vet their sources. That's why we do go with the CDC, our state websites, because again, we recommend them to sites or websites that are up to date with scientific information.
Great. I know for me or for my organization, we try to stay connected with other community-based organizations, like the Health Coalition of Passaic County. And whenever they get new information, we make sure to always include it in our outreach, and that we're knowledgeable to possibly explain more than what is on the paper. So I think, that's the majority of what we do.
Okay. Our next question is for Dr. Rivera. If someone is already vaccinated and becomes pregnant, should they get the booster shot or wait until after giving birth? I think this is a question a lot of people who are pregnant have.
Yeah, so the recommendation right now is to get the booster. That's the recommendation from the CDC, not wait till after. And sometimes this is, it's a mom that is pregnant is just very concerned about a baby. So the message is always the booster will benefit not only you, but the baby. Like I said, moms, there's data that says that moms can pass the antibodies to the baby. So for those first few months of life, that baby is going to be better protected against COVID when they're so little and their immune systems are not fully developed. So the recommendation is just to get boosted.
Especially that we don't have a vaccine for them right now. I think that's the best decision as well. For Danica or Kashika, can you provide a success story of one of your clients that decided to get the vaccine or get boosted? I don't know if you have a story.
I have a success story. So I had a client, she was also pregnant right around March, she was due, and unfortunately she had to have, it was a preterm birth. So they had to take the baby maybe about 31 weeks. And then right after that, she got pregnant again. And the whole time she was just really, really worried about getting the vaccination. And we had to connect her with the COVID team, be able to answer any of her questions. And she did it. And, you know, she came back to me and pretty much said, I'm really glad that I did the vaccination because, sorry, so sorry about that, that they did the vaccination and she was happy that she was able to protect her and her family. Sorry about that, guys.
It's okay. Thank you for that story. Our next question, what do you say, this is for Danica and Kashika, what do you say to the families you work with to help them know that getting vaccinated for COVID during pregnancy is a good choice for them to make?
So I just wanted to jump in. We have some stories just of we call them success stories because mom made the choice to get the vaccine, right, during her pregnancy. And to go along with Dr. Rivera said, there have been so many studies that they're seeing that the umbilical cord is full of antibodies. So we know that whatever is passing through the umbilical cord from baby to mom, mom to baby, you know, for mom, she's giving everything to her baby. So that the evidence is there. I do like to share a story, and it's not a happy story, but it's a real story about a pregnant person that I personally know. This is not even with work. This is someone that I personally know was pregnant. She ended up having COVID, never had symptoms. She never got sick. She just, in general, is a asymptomatic kind of person. She really has to slow down to figure out if she's sick. So she had COVID. It had turned into COVID pneumonia. She never knew. Never had any symptoms until one day it just kind of like, okay, took her out. And she ended up in the hospital. Unfortunately, the baby passed in her womb. And the explanations that the doctor gave her, or maybe the only explanation they could give her at that time, was it was due to the COVID. So, needless to say, and I know that's not the happiest story, but again, I say it's a real story. But needless to say that after that happened to her and she was, you know, able to heal after some time, her and her husband got vaccinated. So we don't like stories like that because we always push prevention, right? We want to prevent anything from happening. We want to prevent you from getting sick or you having to be hospitalized or whatever the case may be. So we always push prevention. But I share that story just to say what, you know, possibility of things that can happen. And of course, with that, she's wearing the mom guilt now about what I could have done, what I should have done, why didn't I, you know, and as friends, you just have to lift her up and say, you know, you didn't know, there's nothing you couldn't do. Again, this was back in, you know, when the vaccine, I believe, first came out, or very new. So we try to, you know, just push prevention. You know, that's why we're here, right? That's why we're doing this, right? That's because we want to get the information and the evidence out so that people, again, have the information to make their own choices. But we want to prevent anything detrimental like that from happening. So I just wanted to share that. And what was the actual question again, please?
Yes. What do you say to families you work with to help them know that getting vaccinated for COVID during pregnancy is a good choice for them?
Well, just for all the reasons we've been saying, it's a way that you can guarantee that you are protecting yourself and your unborn baby, and your baby, period. Because like Dr. Rivera said, there are antibodies that the baby carries for some time after they're born. So because we can't get the babies, we can't give them that vaccine, right? Not yet. So what are things that we can do to protect our babies? So definitely, please, if you can, get your vaccine, get your booster. We even have concerns with moms who are breastfeeding. Should I get the booster? Is anything gonna happen to my baby, pass through my breast milk to my baby? Yeah, antibodies, things that will help your baby. So we again, you know, we just get the information out. We allow mom to have, you know, her fears if they're there, her concerns. We answer any questions. We do refer back to the healthcare provider if there's anything that we can't answer or any fears that we can't kind of calm a little bit. But we definitely are big on sharing information and just lifting up moms and lifting up their stories and their concerns and again, validating them.
Yes, and I want to follow up with that. I always encourage them to get the vaccination, whether they're pregnant, postpartum, or if they're planning. And I just use evidence. I'm like, the evidence is there, the information is there. And even if they're not able to understand it, maybe, try to simplify it in a way that they can understand the benefits of it. And one big thing that I usually, within the conversation, I compare it to where we were when COVID-19 first started and how people were just dropping like flies, comparing it to now that the vaccination is here, now that the symptoms are mild, wouldn't you want that as an option for you and your children, pretty much, and your family and your loved ones? Definitely. And my personal story, I suffered some losses, and we always wish that we had the vaccination in time to prevent those losses. So why wouldn't you want to do that going forward, right? So I definitely use that and try to simplify the benefits of COVID-19, the vaccination, excuse me.
I agree. Our next question is for Dr. Rivera. What is the data showing us about COVID vaccine and breastfeeding?
Yeah, so in terms of COVID vaccine and breastfeeding, there's no reason why you shouldn't breastfeed your baby while you get vaccinated. There's some evidence suggesting that the antibodies can pass to the baby through breast milk. There's some evidence also that if a mom has COVID, the breast milk is not likely to have the virus. So we encourage, the recommendation from the CDC is to breastfeed your baby, wash your hand, like you follow the standard procedures that they're recommended for anytime you breastfeed before and after COVID, like clean your hands yourself, wear your mask, and breastfeed your baby. Just clean yourself and breastfeed your baby. There's no really any data suggesting that you should not breastfeed because you are either vaccinated or because you have COVID, unless you're very severely ill. That's a whole different story, right? That's a different context. But if you've been vaccinated, there's no reason why you should not breastfeed your child. And if you have mild COVID, there's no reason why you should not breastfeed your child if that's what you want to do.
Thank you.
And I'm a little bit biased there because I'm a breastfeeding supporter, like into that. But I also recognize moms that, for one or the other reasons, they can or they prefer not to do it. But if you're a mom that wants to breastfeed, the fact that you were vaccinated or you have mild COVID, that should not be there as a limitation for you to breastfeed your children. And just before we move forward, I just want to back on that Donika's story, sad story, but true story. There is some epidemiological evidence suggesting that moms that get COVID during pregnancy, they have a high risk of some adverse pregnancy outcomes like preterm birth. So there's evidence suggesting that the mom gets COVID during pregnancy, she has a higher risk of having a preterm birth baby, which is another reason why we should vaccinate, like pregnant women should vaccinate during pregnancy if they have not done it before at this point.
Thank you. Our next questions to everyone. How do you speak about breastfeeding and vaccines to your clients? It's just a follow-up to what we just spoke about.
Yeah, so we share the evidence, we share the information, we share the recommendations because we have had some moms who had contracted COVID while their baby was already born and they were breastfeeding. So, the concern, I don't want to get my baby sick. So we give them the recommendations like Dr. Rivera said, wash your hands. If you can have someone help you, bring the baby to you, take the baby away when you're done, wear your mask. Use your resources. If you do have help, have that support person help you with their baby. Again, unless they're very sick, like Dr. Rivera said, then that's a different circumstance. But if you are able to and you want to, please do. So we also say, again, there's no evidence saying that if you get the vaccine, and you're a breastfeeding mom, that's going to harm you or your baby. We say from pregnancy to or pre-pregnancy, preconception to postpartum, there's nowhere in that timeline that's unsafe for you to get vaccinated. There's nowhere. There's through that whole entire period, it's okay to get vaccinated.
Yes, I agree. Again, I usually share, my personal story because, as I mentioned before, I had the baby after the vaccination, and I actually caught COVID as well while breastfeeding. And it was around the time where, the information was constantly changing, but I always understood that the benefits of breastfeeding would outweigh me not breastfeeding. So I use that story a lot. And then now, as Dr. Vera just mentioned, there's enough information out there where we can help them build that trust. And sometimes, I do have participants that tested positive and they're worried. And I encourage them to, okay, well, maybe you want to pump, maybe there's other ways that your baby can still get these nutrients that they need. So I just always encourage them to breastfeed in general. And then, then the COVID-19 discussion will come up and we'll just figure out different ways until they become comfortable to make sure that they're always producing for their baby.
Dr. Rivera, I don't know if you want to add anything to that.
No, they have said it all. Again, vaccination is a recommendation if you want to get pregnant, if you're pregnant, or if you're breastfeeding. That's a recommendation for your health and your baby's health. And that, like Danica said, there's no evidence suggesting any adverse effect because you get a vaccine during that time. So vaccination should be the best option right now.
Yes, I agree. And I just want to ask if there are any final words that you would like to add to our discussion today, just to finalize.
Just want to thank you for having us, being able to get the word out, because I think all of us recognize that there are still a lot of hesitation out there. Even though we have a lot of information and evidence and science behind it, there are just some people that are still, on the fence about it. And like I said, that's okay, but we still want to make sure that we're doing our parts, as community members and professionals and peers, just to make sure that everyone has the information so they can make their own decision. So I appreciate this conversation because I don't think that it's unnecessary. We still need to talk to our pregnant and breastfeeding moms about how important it is to be vaccinated. It's not an exhausted conversation yet. So I appreciate this time and this conversation that we were able to, share more of ourselves and share more about research. So I just want to thank you for having this time.
I would just say that thank you for both of you, to Danica and Kashika, delivering this message to all the moms in the communities. It is true that Black and Brown moms, they will not believe everything that they hear, and they look for other sources because of history of bad public health practices, and that's just a reality that we have in this country. So having people like you delivering that message one-on-one, I think it's best for us. And there's evidence saying that that's what we should do. We should have our peers delivering this message. So Black and Brown moms feel like, they can make a decision, a conscious decision with right information. And always for all of them to consult with their primary physicians, right? That's kind of the bottom line there. When you have doubts, just go to them, because they are the people that will, if you have conflicting information or you're not sure, they are there for that purpose. And again, to protect the health of your health, your pregnancy health, right, and your baby's health, vaccination should be the best option. But again, go and discuss it with your primary physician and talk about it.
Yes. Also, thank you so much for having us. I really appreciate this opportunity and helping to get the word out about the importance of COVID-19. And, I definitely just encourage all those that are questioning to just, stay connected and reach out to your community, your peers. But as Adika mentioned, always check your sources. I think is very valuable information. But overall, just thank you, and I'm happy to be here.
Well, thank you for being here to speak about something so important. I think a lot of people are thinking that COVID, it's not here anymore, it's not important, which is not true. COVID is still here, and it's something that we still need to speak about and get educated on so we can make the best decision for ourselves and the ones that we love. I want to thank you again for being here. And if anybody has any more questions, we encourage you to visit the CDC website and speak to your healthcare provider. Thank you again.